Boa tarde. It's a pleasure to be here. This is an amazing audience. It's very exciting what you're all involved with right now. It's really my pleasure to be here. And of course, what could be bad about being in Lisboa, right? Amazing city. So I have a few minutes to spend with you, and I want to talk about healthcare system transformation. I know all of you have different interests in business, and that's fine. The area I know most about is healthcare systems and the provision of healthcare. I don't work much with biotech companies or medical devices and those sorts of things. I'm going to talk to you about healthcare provider systems. Healthcare systems around the world are challenged in a number of ways. The first is in terms of quality. When we look at healthcare systems, and I can talk about the United States healthcare system, which has its unique challenges. All over the world, though, we're challenged by the processes with which the quality of the processes. Are we doing the right thing? We're also challenged by the outcomes. Are we getting the right kind of outcomes that we need? Best practices. I can tell you that in the United States, for example, studies have been done showing that only half of the time when you go to the doctor will you get the right care, the recommended care. Healthcare systems are deadly. In countries where it's been studied, getting health care, getting your health treated, going into a hospital is deadly. Not everybody dies, of course, but it is a significant cause of death. In the United States, it is the 7th leading cause of death. That's not acceptable. Then cost. The cost of health care is a challenge around the world. In the United States, we're spending over $2 trillion a year on health care, which is about 18% of our gross domestic product. 18%. We spend more than any other country in the world, but here you're spending, I think, about 9% of your GDP. Either way, it's constantly rising and is proving a huge challenge for the economies. In the United States, we spend so much that it is $8,000 per capita. It's just really remarkable. Part of this cost is driven by the cost of technologies themselves. That is, we're doing more things to people, and in many situations, we are helping them in ways we could never help them before. But we're also challenged by the proliferation of chronic disease and by the aging populations. And throughout the world, the Western world, the aging population is a tremendous problem for our economies, but it's also a problem because of the healthcare impact of that, because as we get older, we have more chronic illness. And then in many healthcare systems, we have misaligned incentives, so that, for example, doctors and hospitals may be incented to do things that are in their own interests, but aren't necessarily in the interest of the healthcare system or the citizens. And finally, there's an issue of access. So we do not have enough doctors, for example. Around the world, this is a problem. And even in areas where we do have enough doctors, we have a misallocation of healthcare resources. So in Lisboa, perhaps you have enough doctors, but once you get out to the countryside, smaller cities, you're not going to have enough doctors, and that's a problem. And then we have efficiency problems that make it even worse. So even if you have the doctors there, they're not really using their time in a most efficient way. So these are all massive issues that healthcare systems are dealing with. So now that I've told you how complicated this all is and how all these big problems, you say, Danny, why on earth would anybody want to deal with this? This is just too much of a problem. Well, I'll give you 3 reasons why I think this is a worthwhile pursuit. So the famous 20th century American bank robber, Willie Sutton, got arrested in 1934, and he robbed banks. Now, he was arrested in 1934. In his entire career, he only earned $2 million robbing banks, but that was a lot of money in those days, and everybody knew about this guy. When he was arrested in 1934, one of the reporters, they said, Willie, why do you rob banks? And he said, it's easy. That's where the money is. He spent over half of his life in jail. Not recommending that to you. But the point is there is a lot of money here. And what you're looking at on this slide is a map of health spending as a percentage of gross domestic product around the world. And if you look, so the closer we get to red, The red is 15 to 20% of GDP. That's where you have the United States and you have Canada and a couple of other countries, France, for example. And then you get orange is 10 to 15%, lighter orange is 5 to 10%, and so on. So what you're seeing is around the country, this is around the world, I'm sorry, this is a huge challenge. And as I said, is an economic drain. Countries, healthcare systems are trying to figure out a way around this. How can we spend our money more wisely? The next thing about healthcare that I believe makes it attractive is that all of us know something about healthcare. Everybody is a patient or will be a patient. Okay, if you're not, your time will come, I promise you. So we all sort of know it from an experiential standpoint. We may not be experts in healthcare, but we experience healthcare system. So healthcare touches us all. And the third reason comes from Winston Churchill. He said, the pessimist sees difficulty in every opportunity, but the optimist sees opportunity in every difficulty. The point is, an important lesson in business is that if you want to win big, you have to take risks. You have to take risks. This is huge risk. It's really challenging. It's really hard, but there are big rewards there for people who can really do this. So let me spend the rest of my few minutes with you talking about 3 opportunities that I think are worth exploring. And it's sort of hard to fit this into just 3 things, but I'm going to give you 3 things that I think are right. Opportunity number 1 is collaboration. Collaboration means helping people work together more effectively. It involves elements of communication, co-creation, sharing information, all kinds of interesting aspects to it. The reason this is an important area, not just in business but in healthcare, is because healthcare is complex, as I mentioned to you. We have an incredibly fragmented system of care all over the world, really, which is that if you're a person, perhaps an older person, or you have chronic illnesses, you're often seeing many different healthcare providers. That means all these providers, rather than functioning independently, should ideally be working. They should be pooling their resources, pooling their intelligence, sharing information. We need better tools to do that. As increasingly people are hospitalized, it turns out the time that's most expensive for healthcare is when we hospitalize people. And the time that is more prone to errors and problems, as I mentioned to you, is when people are in the hospital. But even worse than that is once you go home from the hospital. That's where everything is disrupted. And this idea of transitioning patients from one site of care to another is often called transition planning. And collaboration is a key part of that. Patients need to be involved in collaboration. When we think about healthcare, providing healthcare, I don't define it as one person giving something to the other. I view this as a collaboration. Okay, there are 2 parties collaborating. It's the doctor, the healthcare provider, and the patient. And they're collaborating around the patient's health. That's what healthcare really is, if it's effective. And of course, there's the care of the elderly. And any of us who've had to take care of or helped to take care of an elder parent or a grandparent or another relative or friend know what I mean. It's a real challenge as people get older. We need better systems to help collaborate. One company that I'm advising right now is a company called Kinergy Health that is really trying to take this on, creating a patient-centered system of collaboration so that everybody taking care of a patient can share the medication list, the list of things to be done, the care plan, and messaging. It links to electronic medical records. It can be accessed wherever you are through any particular device. But there are a number of companies that will grow up in that space and will develop in that space. There are tremendous opportunities. Opportunity number 2, care at a distance. Did you ever ask yourself why it is that you have to spend time going to the doctor's office, no matter what your problem is? I mean, it really is insane. Your time is valuable, your doctor's time is valuable, and that office space has an opportunity cost as well. It's expensive. So we have to coordinate all of our schedules, fit in that room, and take care of you. But you might ask yourself, why? In the rest of my life, I use other technologies. I don't always have to get you on the phone if I want to meet with you. I'm going to send you an email, or I might text you, right? Why don't we do those sorts of things in healthcare? In fact, I frequently Skype with people around the world. Why can't we use technology like that, and even more sophisticated technology if necessary, to provide that kind of care? So it's about access, convenience, efficiency, and lowering costs. So examples of this are telemedicine, remote monitoring of people who might be ill but don't need to come in. We just have to keep an eye on them to make sure they don't get too sick. And optimizing the care channels. Let me tell you what I mean about that. Let's look at all the different ways we might collaborate to take care of you. And I've listed a bunch of things here. At the bottom, I've listed the office visit. Now, each of these channels of communication has certain attributes associated with it. So the gold standard is the office visit. Why? Because I can examine you, I can look into your eyes, I can really understand what's going on with you the best. That's the highest density of information. But it has downsides too. It has to take place in real time, it's expensive, and so on. Other channels on the list include the telephone call we talked about, text messaging, email, remote monitoring, telemedicine. All these things have attributes associated with them. All right? Burn this into your head for just a moment. Personnel also have attributes. We think about going to the doctor, but in reality, we have many people who could provide healthcare services. The doctor is one, a particularly costly one, but you might have a nurse or a nurse practitioner. You might have a physician's assistant, a clinical pharmacist, a health educator. All these different people, they all have attributes as well. Now, all those people can provide care in the right situations. Each of them has attributes associated with them. You know, a doctor can do certain things and a nurse can do certain things. Every person in the healthcare team should perform at the top of his or her license, meaning we should optimize what they can do. Okay, I shouldn't spend my time as a doctor doing something that would be better, more efficiently done, for example, by a health educator or a pharmacist. And yet, we don't do this in healthcare. It's remarkable. Oop. So there are other people, other players on the list, and we might even add Watson to the list. IBM's Watson and tools like that are going to be part of the healthcare team. There are already healthcare organizations in the US beginning to experiment with this. So the idea is the triage element might be taken care of through a tool like Watson, and then you're directed to the appropriate people on a healthcare team. Now, I told you to burn that image in your head for a moment ago about the different communication channels. Now you got this that I want you to burn in your head, and now we superimpose them. And so now we have a grid. Along the left-hand side, you see the different channels through which we might provide care, and across the top, the different types of people who might provide that care. We need to optimize every single encounter with the healthcare system based on the clinical scenario, the patient's preference, and the availability of these technologies. If we can do this, then we will optimize a healthcare system, which will produce huge benefits in terms of economic efficiency. The third and last opportunity I'm going to talk to you about is patient engagement. Patient engagement is increasingly showing to improve healthcare outcomes, lower cost, and increase satisfaction. It's crucial, in fact, to managing chronic illness. I can't take care of you unless you're part of this equation. I can't force you to get better. You've got to work with me on this. So examples of this are patient relationship management systems, social networks in healthcare, personal health records, and even decision support directed at patients rather than healthcare professionals. Let me just tell you a few facts that I think are interesting. This is a chart of different age groups over time, going from 2000 all the way through 2012. This is US data, but it's very similar to Western Europe. And what you're seeing is, this is the internet use by age group. And if you look across here, in every single age group, the proportion of that population that is online is rising. The most fascinating thing to me is not that 97%, almost 100% of people in your age group, 18 to 29, are online. What's really interesting is over half of the population that's older is online. People 65 years and older. That's really interesting. By the way, you know how many users Facebook has? Facebook. You use Facebook, right? How many users? This is participatory here. Yell it out. 1 billion. Good. You get the prize. 1 billion. But you know what the fastest growing demographic is? It's that dark blue line. It's people over 65. Wow. If you look across all age groups, even in this chart, the oldest age group, in this case it's over 74 and up, looking for healthcare information or getting healthcare online is one of the most common things people do when they go online. Okay? So they're doing email, search, and health information, or 1, 2, and 3, even among the very old. So when you look at, again, this is data from the U.S., over 80% of the U.S. population that is online has gone online to look for health information. Over 80%, 8 in 10 people. It's rising over time, and every day more people search for health information online than see a doctor. Think about that. And more than half of the people who go online are actually acting on that information that they get. And there are many statistics showing that less than half of the people who we see do what we ask them to do. It's really quite remarkable. 40% of online users have read about others' experiences online. Very interesting. 27% of online adults have tracked their own health information online. And a third use social media for health. This is striking. And it's not, these numbers aren't quite there where we are right now, but it is coming. This is a big tsunami. We've got to understand it and hopefully capitalize. E-patients want to be engaged. They want information, they want convenience, and they want communication so they can be more involved in their health. But we stink at it. So let's look at a very simple measure. How many patients really want to do things with their doctor or their hospitals, and how many of them can? So this data is looking at online appointments. The red bars are people who would like to do this with their doctors. And as you can see, it's like on the order of 10%. The green bars are people who want to do this. So there's a huge unmet need here. So we can do a lot. This is online appointments, online billing and payments, online costs, email, and viewing their record. Huge opportunities. One of my mentors, Warner Slack, wrote, "It can be argued that the largest yet most neglected healthcare resource worldwide is the patient." Technology is something that can break down barriers, lower the barriers to patient engagement. And that's why it's so exciting. So we can create businesses around these and really have a huge impact on our healthcare systems. So there's no free lunch. As I said, this is difficult. One must always think about who's willing to pay, who's going to be in your way, who are you disrupting, and will the culture accept the technology that you're bringing in? So with that, I'm going to end, and I would just want to encourage you, look at healthcare. Again, I think there are huge opportunities. I picked 3 of them. Collaboration, care at a distance, and patient engagement. But this is an exciting time in healthcare technology, and in business. Thank you very much for the opportunity to speak to you, and good luck to all the finalists.